Hi, I am Jereco James L. Sanchez. And do you know what to do if you see someone drown and you need to undergo CPR or cardiopulmonary resuscitation? I will tell you what are the steps or to consider in doing cardiopulmonary resuscitation. First, before giving CPR, check the scene and the person. Make sure that the setting is safe. Make sure that the place is not crowded and it is safe. Next is tap the person on the shoulder and shout, "Are you okay?" to make sure that the person actually needs help. Or if the person is not responsive or unconscious, ask for a consent to a family member to undergo CPR. Next is call for help. Medical team or someone who knows first aid kit. If it is clear that help is needed, call the medical team or someone who knows first aid. Or ask someone to call or send someone to get an AED if one is available. If there is no AED available or there is no bystander to access it, stay with the victim, call help, and prepare to give assistance. Next is open the airway. With the person lying on her back, tilt the head back slightly and lift the chin. Next is check for breathing. Listen carefully for the sound of breathing for no more than 10 seconds. Gasping sounds are not the same as breathing. If there is no breathing, then begin CPR or begin cardiopulmonary resuscitation. To begin with the chest compression. Position hands one on the top of the other in the middle of the chest. Push hard and push fast. Use your body weight to help administer compression at least 2 inches deep and deliver at a rate of at least 100 compressions per minute. Deliver rescue breath or mouth-to-mouth resuscitation. With the person's head tilted back slightly and the chin lifted, pinch the nose, shut and place your mouth over the person's mouth to make a complete seal. Next is blow in the person's mouth to make the chest rise. Deliver 2 breaths, rescue breath, and then continue compression. Note, if the chest does not rise with the initial rescue breath, retilt the head before delivering the second breath. If the chest don't rise with the second breath, the person may be choking. There's something in his throat that block the way of air getting into the chest. After a subsequent set of 30 sets chest compressions and before attempting breath, look for an object. If seen, remove it.
Lastly, continue CPR steps. Continue with cycles of chest compressions and breathing you until the person exhibits signs of life, such as breathing. An AED becomes available. When it is applied, continue CPR if patient is still unresponsive. EMS or a trained medical responsive arrives on the scene and takes over. Note, end of cycles if the scene becomes unsafe or you are unable to continue performing CPR due to exhaustion.